Hi, I'm Sari Raskin, and I'm the VP of Grants and Community Leadership at the Community Foundation for Northern Virginia.
What inspired you to join the foundation?
So the truth is, I didn't even realize the value and how meaningful my experience would be at the foundation until I got here. And I'd really not known what a community foundation was when I joined. I joined in 2012, so I've been here for a long time. But what I've learned is that I really believe in this community foundation model. It is an inspiring way to impact community by engaging community, learning about what the needs are, figuring out how you help individuals become philanthropists. They don't even realize that they can add value and contribute to the impact of an organization and help organizations become better. All of that is part of what we do here at the Community Foundation. Our mission is to build a community that works for everyone, and we do that through philanthropy and community leadership. And as the VP of Grants and Community Leadership, I oversee the grants processes. So we give out about $1 million annually in our discretionary grants. So that's the grants that go directly into community, and we engage community members to help us make those decisions. We have our Insight Region reports, which is our data and research center, Insight Region, and I oversee that. And then we also have a scholarship program. And then in addition to that, we run events as well that engages people from the business community, the nonprofit community, government, elected officials. So again, a community foundation, as I've learned, is a very impactful way to engage community, but also to make an impact with the nonprofits that really meet the needs of individuals that live and residents in Northern Virginia.
And then when I was doing my research, I saw you guys have such a strong focus on mental health. Can you tell me a little bit about that?
Yes. So as you have probably heard also within in the headlines and maybe even personally, mental health has really impacted all of us. During COVID, you know, it reached a situation where I think many of us were really impacted in our family and in our families. And we knew that it was a community issue that we wanted to raise. People really weren't, they were talking about it, but they really weren't deeply talking about it. They weren't really thinking, okay, let's think about solutions. Let's talk about how we can really change the what mental health look like in our region. And maybe as a community foundation, we could have an impact because of what I described earlier around who we engage with and who we bring to our events and educate and create awareness about certain issues around our reports and the work that we do. So we took it on in 2022 post-pandemic, towards the end of the pandemic. And it started with some reports that we did. So our first report was finding our way back to mental health. And that was an overview of the mental health issues in our region. We also used it we used our event that year, our Shape of the Region event, which we have annually. In 2022, we focused on mental health using that report as kind of the launch of the issue in many ways. And we brought together experts related to youth, adults, all different types of individuals who are working within the mental health space. One of the things we are proudest of is that we really raised the profile of an issue around youth mental health, and that is that primary care providers, mostly pediatricians in this case, when they are presented with a crisis situation by a young person, they didn't have the resources to immediately deal with that crisis. And so at the event, at the Shape of the Region conference, we featured someone named Dr. Sandy Chung, who was the founder of an entity called VMAP. And VMAP basically provides training to those pediatricians so that when they are presented with a patient that's in a mental health crisis, they immediately have the resources to figure out how to serve that young person's needs so that the crisis will not escalate, and that it can be temporarily solved and then basically sent to someone else who can really meet their needs immediately in a more profound way. So the idea is that we at Shape of the Region presented Dr. Sandy Chung. And then what was an amazing story, honestly, is that because of our relationships, it goes back to what I said earlier and where our community foundation kind of fits into a community, we were able to tap into and leverage our funding community. And 18 funders came together to fund to build a funding collaborative where everyone contributed money. And then there was more funding available for this training. So now the VMAP program has expanded and in the region, but also within the Commonwealth. So not only do we have an impact locally within our community, but we had an impact that's even more far reaching and that will continue to be supported. So not only was it a short term play, but the reality is that now, because all these funders are engaged with VMAP and understand the value of it, because of how we raised awareness, both through our reports and also through our event, VMAP will continue to train primary care physicians so that hopefully it will make change within the region over the longer term.
And then coming soon in Prince William County is the Crisis Receiving Center that the county has put a lot of effort and even the state has. How important is it for the state and county to also focus on mental health?
Yes. So I have to say again, it goes back to the unique position that community foundations sit, and that is, we have relationships with county, we have relationships with the nonprofits. I know there's partnerships going on between nonprofits and the county to make that happen. Actually, we've
Yes.
been in conversations, which has been great. And I, there is no question if we can impact or work in partnership with government to make these services more available and expand services. Of course, there's only a certain amount that the nonprofit community can do. The county, the nonprofit community, and the funding community hopefully can continue to support efforts. If we all work together, it will impact, of course, the community in a bigger way and hopefully make change so that the issues can be addressed over the long term.
How does it feel for you to be helping your community?
So again, we are not direct service providers, but I have to tell you, and I'm a social worker by training actually, but we're not direct service providers in my role, and to be able to really look at issues that are really important in our region. Mental health, one example, we focused on aging in place last year, which there are mental health components to that as well. But to raise issues that are so important for our community to learn about and to get engaged in, and also to make a difference and maybe figuring out some solutions. So it is an honor to be in my role and to connect with people to help find solutions to problems that everyone is experiencing in our region.
What do you do to help your own mental health?
That's a great question. So I am very so as I said, I'm a social worker by training. So I'm very self-aware, actually, I think, about what my personal needs are, and to make sure that I am doing things like exercising and socializing with people and talking to people and making sure that if there is an issue or if I am feeling down in some way, that I seek out help when needed. That's a really great question. So I'm definitely very conscious of how I'm feeling day to day and what I need to do to continue to feel good.
Where do you want to see the community foundation, say, in the next 3 to 5 years?
So we're in a very exciting moment. Our new president CEO is starting in a couple of weeks,
Oh.
and I am so looking forward to her leadership and where we're going. And I hope that the Community Foundation will continue to be a leader in our region and an anchor funder, which I think we are. I think we are one of the anchor philanthropic entities in the region. And I hope that we continue to raise issues that are so important to our community and then help build community around those issues and bring people together, bring stakeholders together to around the table to think about solutions, to try to make our region really a place where there is opportunity for everyone to be successful and healthy and happy.
So how can either nonprofits or organizations that are doing good in the community reach out?
So I think we're pretty accessible. If a nonprofit is interested in learning more about who we are and what we do, please reach out. I'm at cfnova.org. I'm on the website. and I welcome conversations. I love learning about what people are how organizations are having an impact on the ground and what they're seeing in community. It's so important for us always to have an understanding of what's happening within community because it only helps us do our work better. And I think that we've created mechanisms. We're always working and striving for this, creating mechanisms so that we're as accessible as possible to organizations who are interested in learning more about how they can get more funding, but also connections. I think one of the value we have limited funding, even though I said we give out over almost $1 million in discretionary grants. That's only a drop in the bucket, honestly, as you can
Right.
imagine, right? About what the great work that our organizations are doing in our community. That doesn't necessarily meet, that will never meet all the needs, right? But I think what we do is we see ourselves as a connector. And I spent a lot of time building relationships with nonprofits, governments, private sector individuals, and then I try and make connections. So if we can't give an organization funding, we hopefully can help them grow their organization and build their own capacity so that they can become better.